Actually, this is actually a great segue into the main topic. And it's a topic that I wanted to talk about. It is generational trauma. And the reason why I wanted to talk about generational trauma is because it kind of came into my head with the Kirk Franklin situation, how I would describe it. And so with my grandma, she's a person that just cuts you out because that's just granny. And so, a lot of her kids adopted that same thing as far as cussing out. But, you know, even though we feel like in my true stuff, I feel like that's the norm. But me displaying that to a kid might not be the norm because they can take that in a different way. Me, I can look at it that as grandma. But if I do that to another kid, or I do that to my son, or do that to my daughter, that can cause them some significant distress. And
Hmm.
so that's why I wanted to talk about that because a lot of times in my sessions, people don't understand like how our behaviors and certain things that happen to us get passed down from generation to generation. And I know with my family, for instance, my dad's side of the family, they don't talk too much about stuff. Like my mom, she tells me everything. Like even if it don't sound good or whatever, she tells me everything about that family because she doesn't want the same thing to happen when I have my kids or my sister have her kids and I'm raising my nieces and nephews. And so what do you think about generational trauma?
I think it's real and it's prevalent. And actually, I wrote this book, Breaking Down Barriers Between Mothers and Daughters, right? And it's got little activities and stuff in there. And one of the chapters is called Your Mother is Somebody's Daughter, right? And so this chapter is directed to a daughter to help understand your mother's behaviors. They may not be healthy, they may be hurtful, wrong, all of these things. And this doesn't take away from that, but it's to help people understand that those behaviors came from somewhere. So with generational trauma, there's some kind of traumatic event or events that occur. And when you experience a trauma, any person, there are cognitive effects, emotional, and then there are behaviors that you display based on those effects. And then whoever's around you, they experience those outcomes. So if I'm having a flashback and all of a sudden my mood changes because of, this thing that happened, you may not understand that I'm having this flashback. You may not understand what's happening for me internally, but you certainly understand that my mood changed. You certainly understand that now I'm going off on you and you don't know why. And all of these things are playing, a role from generation to generation because we learn to cope from our parents. We learn how to express ourselves from our parents. And it's not just our parents, everybody in our family. All of these things play a role in our development, and then we go out in the world and we present these things.
You're right, and a lot of times it's not just the trauma; it's how you said how do we respond to the trauma, and so how we
Mm-hmm.
respond, our kids and kids can see how we respond to things, and then when they go through something, they can respond similar. And so, I know alcoholism can be prevalent in a lot of families, and so, some people can drink because of they're trying to bury some type of trauma, and so they, when their kids see like, okay, I see daddy always drinking every day, I think that's what you're supposed to do in order to suppress your thoughts, then they can
Mm-hmm.
start drinking heavily as well. And I've seen a lot of people do that because I think that in our culture, especially the Black culture, we have a lot of norms that people think are normal, but if you look deeper into it, they're not. And so, well, a lot of us that I counsel, a lot of people smoke a lot of weed or they drink every day, and they're like, well, I need to take my mind off the thing, but you're not really handling the situation at all. You're just probably seeing your dad and your mother drink a lot, or you're seeing like a friend or family member. That's how they kind of help themselves out as far as suppressing thoughts. But all you're doing is putting in the closet where it's going to keep on collecting and collecting until you have an outburst. And
Mm-hmm.
so that's why I encourage people to talk to your kids, talk to your family members about things that are going on. It might not sound pretty at all, but that's not the purpose. The purpose is that they have a knowing of this is where this stems from. And so this, like I was talking about with my family members, like hearing stories about my granddaddy, hearing stories about my grandma through my mother, it made me better understand them and make it make more sense. And so I can understand why certain behaviors they were displaying and why were they displaying them. I didn't think like, oh, okay, he was doing this because it came from that is how people are. It was because he'd been through some stuff that made him react in that way.
Mm-hmm. And then give them an opportunity to break the cycle so that the next generation doesn't have to experience that.
Exactly. And so just for a lot of traumas, I mean, there was just one movie on Netflix, I forgot the name, but it was like a clear depiction of how generational trauma can affect people, because it was a person that was touched in the family. What I mean by touched, it was molested and stuff, and they was doing it to another family member. And so I know, for instance, like a lot of stuff like that, people keep it a secret, or people like to bury it down because they don't want to expose the family member or knowing. And I counsel a lot of people to where they were like, yeah, I had an uncle that was touching me. They didn't believe me. And so with that type of trauma and people not having that voice, then it kind of made them display certain behavior themselves as an adult, which is my profession is substance abuse, but that can be displayed in so many different ways.
Mm-hmm. Yeah, hypersexuality, depression, trauma symptoms, all sorts of anxiety, all sorts of things.
Yeah, definitely. So that's why, again, I encourage people to have these conversations with your kids about this thing that you know in the family, because I know as far as Black history, I only can go back as far as my great grandmother, because, due to slavery, we don't know too much. But we need to continue these stories, good and bad, because people need to know where they came from so they know that, okay, I'm going to end this specific trauma now. And so I know even with me sometimes, one of the main things that I do that I need to stop, and I was cognizant of, is like sometimes I act like my granny. Like if I see a little kid, instead of saying like, don't do that, like, what the fuck you doing? So sometimes I had to check myself and being like, even though that's been normalized behavior to me, sometimes if I talk to somebody else like that, it might not be normalized to them. They can be scared because I'm 6'8", 320 pounds. So some type of, verbiage comes from me like that, it can be taken in a whole different context. And then they can pick that up. And then once they get older, they can do the same thing. And so I want to just encourage people just to have those tough conversations.
Yeah. And have them sooner than later, because I'm currently seeing this play out, and it's more of like those so they talk about trauma with a big T. So like I saw someone get murdered, or trauma with a little t. I broke my arm when I was 7. Trauma is trauma. I don't know how I feel about big T, little t, because it's all subjective. But in a situation that I'm working with right now, there's a child, an adult child, who feels like just the fact that his mom always said, because I said so, is now affecting him as an adult. So he doesn't ask questions when he wants to know something, when he disagrees with things, he doesn't really speak up. And his mom is like, look, I've been hearing because I said so my entire life. My mama said because I said so. My grandma said because I said so. You gonna hear it, and your son gonna hear it, and it's because I said so. And I'm like, okay, to an extent, I hear what you're saying. Sometimes, go get me some water. Why? Because I said so. But when it's a bigger thing, when your child is coming to you and trying to express like emotions or confusion or these things, and you like telling them to go away because you said so, it can have a different effect on the child. So I'm in the midst of trying to help this adult child understand that, yes, this played a role. Now you're an adult. Now you're able to speak up, but that doesn't mean you have to be aggressive and hostile, because he's like swinging in the other direction at this point. He's like, I haven't said how I felt for 27 years, and now, everybody gonna get it. And so it's like, you don't have to be that way. Like, we understand, you're right, that was not okay. Now that you're an adult, you have control, and you have to decide how you're going to react to things. And mom, you have to acknowledge that sometimes because I said so is not the right answer, and let that be that. So I think like just approaching these situations as soon as possible, as soon as something comes to your mind and you realize this might not be right, that's the best way, so that you don't have to go years and then swing your pendulum in the other direction.
And one thing that I'm an advocate for is that I know sometimes people post these videos of kids getting their ass whooped, and I'm like, I don't think that works. Like people think like, oh, a good old ass whooping, that's what they need, an ass whooping. I'm like, look, all these kids in the 80s got their ass whooping. Shoot, it was a whole bunch of crime and a whole bunch of this during the 80s. And so I don't think whooping a child's ass like that works like that. And that's what I'm talking about even with generational trauma, because that was just the way they knew how to child rear back in the day. But I think as parents in today, and I'm not a parent, so you can kind of speak more on this. But I think parents of the day, they more like, let me sit down and talk with my kid instead of this. Every time they piss me off, I'm just gonna pull that belt out and whoop their ass and say like, don't say nothing else, don't say nothing. Just take this whooping and be done with it. And so then that's the question I have for you, because you are a parent. I mean, you don't have to put everything out there, but do you feel like that you kind of learn from your parents and kind of like, well, these are things that I like that my parents did, but some things I didn't like, I kind of changed?
Yeah, absolutely. I think everybody does. I think sometimes it can be counterproductive. You can, like, if you had a very, a parent who was very strict, you can become too permissive, and, the other way around. I think there's always a middle ground that needs to be found. But my mom used to give me whoopings up until I was 12 years old. Okay, big 12-year-old getting a whooping. And one day, my friend was in the other room, and she gave me a whooping, and she was like trying to like embarrass me because she knew my friend was in the other room, and I didn't cry. I was just like, not embarrassing me today. Ain't nobody gonna know what's going on in here, And she never whooped me again. She was like, okay, at this point, she's become desensitized to whoopings. I'm not gonna do it anymore. And that's what happens, when you hear kids all the time say, like, I'd rather take the whooping than be on punishment because I got to go to my friend's house. So it's like, it's not really helpful. And what I've noticed is most of the time when a parent is whooping a child, it's because they feel like they're out of options. They don't know what to do. And so they like, I'm gonna just give you this whooping, or they're mad. And you really don't want to teach your kids to assault people when they get angry. That's definitely not what you want to do. So I'm always, an advocate for figuring out another way. And that doesn't mean be permissive and let your children do whatever they're going to do. And then, talk about it after, because that's where that act now, apologize later comes from. There should be consequences, but yeah, whooping your kids is probably not going to be helpful.
And that's one thing I do see, like when I counsel a lot of teenagers and their parents, is that like this generation is very different, because it is more of they have the ability to talk and express their true feelings. Sometimes when I hear how kids talk to their parents, sometimes I be looking like, Linda, what they had there? I said, y'all can say stuff like that? Like, Linda, I just be quiet and listen and shook my head like, but I think that's good that they have that ability to talk. But then, kind of like when we talked about that Cam Newton situation like 3 or 4 weeks ago, I think there's I kind of think we got to teach our kids like, okay, you can speak freely, but you have to be respectful in how you talk.
Absolutely. You have to learn to effectively communicate. Yeah, my eyebrows go up a lot because my teenagers feel really comfortable with me. They're like, yeah, she, they think they can tell. And sometimes I'm like, girl, no, well, you can't say that to your mama. Like, that's not okay. So yeah.